Hi, I'm Terry Murphy, Senior Editor for Realty Times Women in Business, Women in Real Estate, and In the Men's Room with Murph. And we have the pleasure of having our guest back today, Dr. Gary Burris. He specializes in human capital development with a focus on human resource management. What that means is he knows all things HR and has been in the senior level of hospitality management, including human resource management for many years. Here's the thing. Gary, thank you for joining us today.
It's my pleasure. Thank you for having me back.
Well, it seems like we need to have you almost every day because the impact of COVID on the workforce and the workplace today has been hard to deal with. It's been a challenge and it's ever changing. And it makes sense because it literally changed the face of how we're doing business today. And one of the latest directives from the Center of Disease Control has really put a little fly in the ointment. And I'd like for you to explain to the people that are listening and viewing this what we need to know so that we are safe and that we are proactive in how to handle the whole COVID thing in the workplace as it pertains to staff and business.
All right. Well, thank you very much for having me back. So COVID continues to change, and the Centers for Disease Control continue to learn more about this virus. And it's interesting as you follow this because it's taking on, it's epidemiological, but it's become political. And so we see a lot of different responses in America with all of our freedoms to how this virus behaves and how we choose to behave in relation to it in the workplace. And if we go back to the beginning of this, I keep thinking about this, and you and I both knew from our very first video, we said, okay, here's where we are today. And I remember the day I said it, it's not raining frogs. And I said, we're going to continue to learn more about this, and it's going to continue to change. And that's exactly what's happened. So at the core of everything that anybody listens to these videos, I would say it still remains the same emphasis is cleaning, 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 and people, people, people. And if you're a business owner, you need to be seen cleaning and you need to be seen peopling. Now more than ever, that has become important. In our last series, at the time we did that, everything had shut down for the most part in America. And we began to say, okay, you need to prepare for reopening. And we discussed things like preparing your company for reopening, your training programs, working from home, preparing a practical guide for your leaders so that you knew how to handle these sort of things. And those were the things that we suggested that everybody need to do coming out of this. So now here we are today. The economy began to reopen. We had all these rules for reopening. Everybody started to come back. And now we're going to talk a little bit about what that's been like. So as I've done research and I've spoken to different organizations, I've seen how it's impacted organizations that I serve. We see how we do these things and how we responded to it as an organization. I think there's some information worth sharing with your listeners and your readers. And I'd like to go over those with you if I may. So first thing I want to talk a little bit about is now that we've come back, and if we did all these things we talked about doing, a little bit of an issue with training. So what we noticed is that there was an initial training versus an ongoing training. And so the question I have for your listeners is, when you did your training, did you put the training that came out of CDC, how to be safe in the workplace, did they put that in direct relation to the jobs themselves? My research has shown that for organizations that did training to bring everybody back, that in some cases that training may have literally went in one ear and out the other of some of the employees. They sort of did chapter and verse. These were things that people had heard on television about what we should do in terms of physical distancing. And the two things I found is that in one case, perhaps, they did not put the training in context to the job. So there are organizations that did not necessarily go in and reevaluate their workspace to make sure they could keep people 6 feet apart, those sort of things. For example, imagine if you are a restaurant owner, kitchens in restaurants are normally very small. They're designed to be small. They're designed to be very motion fluid. And so it's very difficult to keep people in those kitchens 6 feet apart. Well, if you cannot do that and somebody ends up getting COVID, it can end up shutting down your entire restaurant. And I've actually spoken to restaurant organizations, large chains that will have 6 to 10 of their restaurants closed down just because one person in the kitchen got it. Therefore, because of physical distancing, they were not able to continue operations. So everybody's got to go out, got to make sure everybody comes back safe. So we noticed those sort of things. Also, the need for ongoing training. This is not a one and done situation when it comes to dealing with your employees. You gave them the initial training so that they could come back. Now it's constant ongoing training. I am of the opinion that human beings can learn to live with anything. It doesn't matter what it is. If we have enough repeat exposure to whatever it is, we can learn to incorporate it into our lives. People have done this with COVID-19. And we've seen everything from just people not thinking it's a big deal to people thinking they can't get it to people taking it very seriously. So because of that, you need to have ongoing training. It's not a one and done thing, because if not, somebody's going to end up getting this. So, and here's what I mean by that is what your employees do outside of work is as important as what they do inside of work. But you as an employer cannot stop what they do outside of work. So many times in my research, it's showing that at work, there's a lot of rules. At work, there's physical distancing. There are signs on the walls before you can come in. You do wellness attestations. If you are an employee, some places you have your temperature checked. They encourage you to wash your hands for 20 seconds frequently. But when you go home, all of that disappears. And I've seen some organizations that employees, the minute they go on their break at the building, they think COVID no longer exists on their break, and they'll take their mask off, while they're on their break, or they're smoking, or they're talking. So it's very complex. So you need to make sure that the training is ongoing. And I'll stop for a second just to see if you have any questions or comments.
Well, that socialization factor is an issue because it's not just going home to family, but where the family has been. And so it just seems to me like it's a almost impossible challenge, especially in specific industries like food and beverage or health. How would an employer actually manage that?
Right. Well, health is a whole different issue because there are specific guidelines in the COVID-19 crisis for dealing with essential employees within the healthcare industry. And I also do human resources within the healthcare industry. And essential employees there are treated much differently if they are a close contact exposure or if they even have COVID-19. Things such as use of N95 mask, routine monitoring throughout the day. But for everybody else, it's different. And so things that I've done and I've advised is training doesn't have to be a formal training. It can be constant reminders. Those are shift briefings, those are Zooms, those are text messaging to your associates, those are emails to your associates, sending flyers out to your associates. You got to constantly level through these things to make sure they're hearing the message enough to where it's important to them. And so the questions I would ask for people: are you doing daily wellness attestations before your employees come to work? Are you checking temperatures or having them check their temperatures and attest that they don't have one? And then what do you do at work when we see these little micro violations? This happens all the time. Something I find is sometimes employees are afraid to tell somebody else that you need to put your mask on, right? And well, I've known you for 20 years. We know each other. We go way back. I feel comfortable with you. You don't look like the kind of person that would get it, all these sort of things. So we don't see massive violations of policies in the workforce. What we see are these little microscopic ones that need to be addressed by supervisors the moment they see it. It needs to be that serious. If people can physical distance, they should. The one tool in the toolbox that HR typically has when they're doing case investigation in their workplace is 6 feet, 15 minutes. That's the number one question that employers should ask employees if they end up notifying the employer that they have COVID-19 and they cannot attest is, during that look back period, were you within 6 feet of anyone for 15 minutes or longer? And if they were, and if your workplace has video available, double check it. But the case investigators within human resources are constantly having to go back and make determinations about who else goes out. So it's not just the person that's got COVID-19 that goes out and follow the CDC guidelines on self-isolation. You as an employer, and it always falls to human resources, has to decide if anybody else was in close contact and they have to go out. So you would think that, is it the COVID-19 that can shut down an employer? Well, it can, but in large organizations, it's not just COVID-19, it's all the close contacts. So one person who has COVID-19, if they're not physically distancing while at work, they can put out 4 to 5 average per case. So one person that's COVID-19 puts out 5 people. Some organizations can't handle that. So you'll end up having twice as many positives go out as you do for people who actually have COVID-19. So it's constant messaging to your employees. It's constantly reminding them this is important. And at work, it is having supervisors repeatedly correct people because, you get a little older in life, you get used to doing things a certain way. It was so hard. When's the last time you shook someone's hand?
That socialization factor is such an issue, especially with people you're familiar with. So, you see somebody every day that you have for 20 years, and all of a sudden you're saying you're not wearing your mask. I totally understand that. But there's some other issues now, even with testing, that are inconsistent.
Right. Well, it's not that it's inconsistent, but you bring up a really good point. So we are learning, this is a novel coronavirus. So the CDC is learning more about this every day. And so as they learn things, they are going to constantly have to give the public direction that they need. So I know originally when this started, if you were COVID positive, you'd self-isolate upwards of 30 days and then have to get 2 negative tests before you were allowed to return to work or do anything like that. So what I'm going to tell you is that the rules for the CDC continue to change only because the nature of the virus that we're learning about it continues to change. So we said it in our very first video that this is subject to change, and here is change. And then I will tell you, yep, it's going to keep changing, and it's not a bad thing. It's when you're dealing with a new disease and a pandemic, as they learn, they're going to do some things. So, and for employers, it's good news that these changes because we're getting better at it. The treatments for it have improved and all those sort of things. So I'm going to refer to my notes, but I'll share with you what's going on. So there's always been 2 tracks for basically getting people back to work. You had a test-based track, which people are very comfortable with now because, it's a gold standard. If you get a test and your test is negative, that's great. Only thing with the testing is, within 48 hours of exposure, it's not necessarily very good. So if I got COVID today, it may not show up on a test within the next 48 hours because they're just not that sensitive. It takes up to 14 days for symptoms to develop if you're going to get this thing. So obviously the tests are more accurate towards the end of the 14th day than they are on the first day. But people are very comfortable. We've gotten used to testing, all in politics about test, that sort of thing. But there's always been another track, which was a symptom-based track. So you could either be released from self-isolation if you had a test or if a certain amount of time had passed and symptoms had passed, but it was pretty much one or the other that we could do. So the test-based strategy, so think of it like this. For people that are COVID positive, they would isolate until the illness passes or no longer infectious. Originally, this could have been up to 30 days, and then you provide a negative test to return. So if you were an employer and somebody gave you a negative test, you felt confident you could put them back into the workforce. Close contacts, it remains 6 foot, 15 minutes. That's the only tool HR has in their toolbox to try and keep this at bay. and you put them out for 14 days, the employees, because it takes up to 14 days for the virus to develop in your system, up to. And so here's one thing too, I will tell you. I found out that when employees find out they may have been a close contact to someone who is COVID positive, they always want to go out and get that test immediately. And they're not the most comfortable test, okay? The rapid tests are not bad, but those other ones, they go far back into the nasal cavity. You don't want to do those too often. So initially, employees always want to go out and get it done. And I'm like, here's the problem. You're getting it done. You know, I told you that you may have been exposed today. You ran out and got it this afternoon. You're going to have to get it again before you come back to work. So just wait, self-isolate for 14 days, get your test, get it done once, and then come back into work. So I would say don't get too early. The other thing employers have to consider is whether or not they want to pay people to be out. So if you put them out from work, they want to come to work, and you're telling them as the employer they cannot come to work because they may have been a close contact. You know, HR tries to determine, are they close contacts due to things they did outside of work, or are they close contacts because they happened in work? You have to decide whether to pay them or not. I've done research on this. I've reached out to multiple organizations across America, and I asked them about that. And my research shows that putting close contacts out for 14 days, for the most part, 85 to 90% of organizations are doing that. That's their current method of dealing with this. I believe after the results of these changes for the CDC, it's going to now go back to making some changes there. Also, whether or not organizations pay people, I've found that larger organizations are paying their people if they put them out, smaller organizations are not. So let's jump into the answer for what's changed in the CDC. So you always had two tracks, test-based and symptom-based. A lot of organizations went test-based because it's easy to understand. You know, we love tests, I passed, right? But symptom-based has always allowed you to go out and stay isolated for the duration of the illness and then come back when it's no longer infectious. So it used to be if we put you out, or if a health department put you out, they would keep you out for 30 days. That has changed, and so we started testing employees at 14 days. So now what CDC has come out and said as of last week is that we believe that if you are COVID positive, then from the date of your positive COVID test, if not symptomatic, or from the date of your first onset of symptoms and a positive COVID test, that usually runs 10 days. So if you're positive now, let's just say you went to a family reunion, you found out your uncle had it, you were in your uncle's presence, I better get tested. You go get tested, hey, you've got COVID-19, but you don't have any symptoms. From the date of the test, you would self-isolate for 10 days. Now, what CDC is claiming is if you have mild to moderate symptoms, then over that 10-day period, at the end of that 10-day period, you're most likely not going to be infectious. So you can be released from home isolation. So if during the 10 days, if your symptoms have improved, it used to say if respiratory symptoms have improved, but they changed that because they keep adding symptoms. The symptoms of COVID, which everybody would attest to in the beginning, that list has now been expanded. By the way, if you're having your employees do wellness attestations, you need to now change them to add these new symptoms. And it's getting to the point now where it's hard to attest to anything if you have any sort of sinuses or anything like that. So here we go. 10 days, if your symptoms have improved and in the last 24 hours, you have no fever without the use of fever-reducing medicines, then you can leave self-isolation. This is important for employers because employers have to decide what they're comfortable with in letting their people back. So some employers will say, hey, I appreciate CDC guidance. I appreciate that they are now actually recommending to go away from testing. They are now recommending to go to symptom and time-based. Some employers will have to make the decision if they're comfortable with that. Because if a person has, if they are immunocompromised, which means your body cannot fight this off as well, or if they've had a particularly severe case, then 10 days may not be long enough. So it is possible that this is going to catch most, but not all. So here you are an employer, right? Now you got a decision to make. You want to keep doing test-based, but health department has released your employee from isolation. So you're going to run into these sort of things. And there is something called a persistently positive person. And I don't mean as an upbeat and positive either. Go ahead, Terry.
Persistently positive. I just want our listeners to let that sink in for a second. So go into what that actually means.
Okay, so if you follow a test-based approach to allowing your employees to come back to work, they've had COVID, but at the end of their actual illness, when they are no longer infectious and the virus cannot replicate itself and you cannot spread it to others, there will still be leftover RNA remnants of that virus in your nasal passage, and that can last for weeks. So you're no longer sick. You cannot make anybody else sick, but when you go to get a test, you're going to keep testing positive for COVID-19. So those are persistently positives. And if you follow a test-based approach, you're going to run into those. And these are people that want to come back to work, but you won't let them back into work because they cannot pass a test. So in a case like that, you work with the health department, you work with their physician, and you get them released back to work. Even though, yes, they tested positive, they basically do not have it active and cannot make them or you sick. The issue is, if you do not educate and prepare your workforce that you're going to let somebody come back in, they're going to come back in and say, oh, yeah, well, I'm still positive, but the employer said I could come to work. And it's just going to start all kinds of rumors. So you got to learn to deal with persistently positive. So if you go to a time and symptom-based test, when the health department releases them, you get that release, you just let them come back in, you know that chances are that they are going to be well. And it's only really a concern if the person has a compromised immune system, meaning that it can last longer in their body. But that's what's changed. It went from a 72 hours improvement of respiratory system and no fever to 24 hours improvement of symptoms in general and no fever without fever-reducing medicine. That's the big change that they made last week.
It's really gotten a little bit more complicated, and employers, I don't know how employers and management and HR departments are actually keeping up with the multitude of issues that they're dealing with in the workplace as we go back to work. Our first series was, here it is, what are we going to do? We're sequestered. Second series was, now we're going back to work. What are the protocols? What are the trainings? And now here we are seeing as it morphs and as it transforms, what we can do. So this is an ongoing series as you research and continue to get information from CDC and we get results. You talk about tracking. How are we tracking this? Do you want to speak briefly to that?
Yeah, so if you run a small organization, it's probably not that difficult, but you still need to do it. You still have a responsibility when you hold your organization open to the public through invitation and you have employees working for you. You don't get a pass just because it is a pandemic. You have a responsibility to educate yourself and to provide a reasonable degree of safety for your employees and for your customers. So even if you're a small organization, you need to track your employees to make sure that you're training, educating, and enforcing your rules at work. The best thing you may be able to do for somebody is to make sure you correct them when they accidentally or purposely step out of line, okay? But you have to track. So for larger organizations, it's a little more difficult. If you have organizations, 5 to 10,000 employees, initially, I will tell you, you never heard me speak about it because everybody was like, well, the health department's going to track it, right? Health department's going to do this. Well, yeah, they're going to contact trace. They're not going to tell you what to do with employment. So it falls to HR. HR gets the brunt of that. And originally we just had to come up with case investigation spreadsheets to where we knew exactly what to put in, how long people needed to be put out, when they should come back for testing, the context. Did it happen at work, we think? Did it happen outside? And amazing information in these things that you developed. For example, initially I knew that people were getting tested because they found out they were at a social gathering with family and friends and one of them had gotten it, so they got tested without symptoms just because they were worried about it and they were positive. And then later it became symptomatic, meaning people would start showing up not feeling well and they get tested because they had symptoms. And then all of a sudden, as the CDC changed the symptoms to include, things like diarrhea, all of a sudden employees started having symptoms like that. So a lot of information in those spreadsheets. Now technology is caught up and you have all these companies that are out there wanting to sell this case investigation software. This is something you can do for yourself, but whatever you do, you got to do it.
And you mentioned it was as simple as Excel spreadsheets and Google Forms. So if you're a smaller company, you don't have to invest in big time software to figure this out.
No, you don't. You just need to do the right thing and track it, because you need to make sure it's part of your business. So if you made the commitment to pay your employees to be out, and again, larger ones do, smaller ones maybe cannot afford to do that. You want to get these people back to work as soon as possible. So you need to track and when they go out, when they should come back to work, those sort of things. And the big thing I would tell employers about that is if you have even a few hundred people in your workforce, keep your case ID numbers in some sort of way so you can keep your cases together. Whether it's something as simple as the employee's last name with the number 1, meaning that they were the genesis of it at work, and then you can put other people's, use that same thing in a running number to keep track of similar cases. The point there being you need to keep track of similar cases so you can track it. And again, this is where we are. So we talked about initially, here we are. What do we do with this thing? Okay, take care of your people, be sure to take care of cleaning, take care of your customers. And then we all got shut down, and it's like, let's talk about getting back. Here are the best practices to bring your business back to work. And now here we are saying, okay, how did that work for you? And it has been these little, and I'm telling you, one employee in the right department. And, I'm real big into strategy. So you and I have talked at length over the years that there are strategic positions, important positions, and surplus positions. If somebody in a strategic position that your company relies on for its existence gets COVID and goes out, it can majorly impact your organization. So if you have employees that can work from home that are in strategic positions necessary for the functioning of your company, you might want to consider allowing them to work from home. That is just good business continuity planning.
So obviously we have some work to do, and these updates will continue. Do you have any closing recommendations for people who really need a vested interest in the whole ongoing management of COVID in the workplace?
Yeah, if you're a small company and can't afford things like a consultant or anything like that, avail yourself of your government. I have found particularly that the local health departments, my experience with the local health departments during this pandemic, because we have employees that cover multiple counties and multiple states, has been that the nurses and the contact tracing teams are very upbeat and positive people. And they will do a lot to help answer your questions. So if you're a small company, avail yourself of those local health departments, and they can at least assist you in direction. The Center for Disease Control always updates their website. Take the time to read through their website so you can understand what's going on. If you can afford it and you need it, consider hiring a consultant who has just been dealing with this since day one, and allow them to help set up a contact tracing, or as I say, a case investigation program. The biggest things that I would say considerations people need to do, and I have to look at my notes here, is train your staff to take their temperatures every day. Those temperatures are actually the big one. We're in July. There shouldn't really be a reason for you to have a temperature right now. So temperatures are big issues. Make sure you're either taking them or you're having them take it and attest that they don't have one. Train your staff on the basics of prevention in the workforce. Make it apply to the job in the workforce, okay? In other words, don't just say CDC says you need to stay 6 feet apart and you need to wear a mask. How does that apply to the person that is cleaning? How does that apply to the office staff? Physical restructuring of your offices. Go into your offices today and look at what everybody are doing. are they at least 6 feet away? If they're not, you need to restructure your office environment temporarily so that people can stay away from each other, okay? The only tool in your toolbox right now is physical distancing. That's all you got. There's nothing else you can do. Masks, okay, let me address this issue with masks. An N95 mask that has been properly fitted to you, not just something you bought off the internet, but if you have an N95 mask that has been properly fitted to you by somebody who's certified to fit you, and if you wear that mask continuously and properly, that will offer protection. These facial coverings that everybody in America is wearing, it helps, but as an employer, it's not going to keep you from putting somebody out. If somebody violates that 6-foot rule for 15 minutes or more, my advice to you, time to send them home. What that mask will do is it will lessen the chances that they will actually get COVID-19, but you can't use it as a decision factor in whether or not you send somebody home. It's just that 6-foot rule. That's the one I cannot get through people's head. Well, I was being totally serious when I said stay 6 feet away from people. They'll do it all day long till they go on lunch break. And then 4 or 5 people will sit at the table eating tacos on Taco Tuesday, talking to each other, and you just want to smack yourself in the head because you cannot get it through their head. No, seriously, 6 feet means 6 feet. Let's see, I would tell you, become familiar with the changes to CDC. They're changing it because they really know what they're doing, and they're getting this thing down to a science.
You also you talked about enhancing cleaning practices as well. And I know that some companies have gone to steam work on top of regular just seeing. And then you talked about making sure that people see that, because I think we get comfortable. Now, the shock is worn off. We're cleaning, we're washing our hands, but then we get comfortable with that. And then maybe we're not continuing. So cleaning required is an ongoing focus for almost all companies.
Absolutely. And it's not just cleaning, it is being seen cleaning. So you and I always said it is people, clean, be seen people and be seen cleaning. Honest to goodness, right now you're in competition, and I got news for you. There's more than one company that manufactures tires. There's more than one company that manufactures paint, offers hotel room, makes hamburgers. We are all in competition in something that is highly commoditized. So what I would tell people is your customers will feel most comfortable if they know that you have rules about this. Now, I don't know why everybody in America seems to be fighting these rules about wearing masks. It's like it's an affront to our essential liberties or something, but they are. So if you want to set yourself apart from the competition, be seen doing things that are right. Your employees will actually develop faith in you if they know every time they violate that 6-foot rule that you correct them. You will build faith that you're always doing the right thing with them. And then what I tell you is, guess what? Stand by, because things will change again, because we're learning more about this virus every day, and they're coming up with new ways to treat it. And keep an eye on what local and state governments are doing also, because that's going to impact your business to stay solvent during COVID-19. And if you look around, there's a lot of companies that have shut down. They're not going to make it back from COVID-19. We see this every time there is a national issue. We saw it just during back in 2009 when we went through the economic downturn. For example, there was Circuit City, right? And Circuit City's gone. So there's always going to be something. Keep an eye on that. So it's going to change. Get used to change. Change is okay, but it's always going to change, not because they're telling you to do something completely different, because they are starting up here at the general and they're learning to get very specific. So there you go, and we'll talk again next time when there's something new to add, and I hope this does something for your viewers.
So Gary, I know that you do consulting for companies. What is the best way to reach you, so that if somebody has questions or they have interest in your services, what would be the best way to contact you?
I'm a LinkedIn junkie, so go to LinkedIn. You can look at some of my work that I've done on there, academic research I've done in strategic human resources. You'll see some of the videos that you and I've done. So that's a good place to check out the kind of work I do and see if it's a fit for your company, and just reach out to me on LinkedIn. And if I can do something for you, I will.
Gary, we so appreciate you sharing your wisdom and certainly your expertise in these incredibly bizarre times in our life and in our workplace and in our industries. I'm hoping you'll join us again for another segment to help people with their businesses on Realty Times, Women in Business, Women in Real Estate in the Men's Room with Murph. Thanks so much for joining us. Tune in again to hear from Dr. Gary about what's next and what's new with COVID-19.